Julie, the Menopause OT here, answering some of your questions. You want to know how safe is the estradiol pill version for HRT. So oral estradiol is very safe. We do know that transdermal estradiol in the form of a patch or gel or spray is slightly safer, and that's because it is not processed through the liver, so it does not increase your risk of blood clot. There is a slight increased risk of blood clot with oral estradiol because it does go through first pass metabolism through the liver. So that risk, though, is still very, very small. It is lower than the risk of using oral contraceptive pills, which many of us have taken and accepted the risk of blood clot with. It's also much lower than the risk of blood clot when you're pregnant. So if you have a very low baseline risk of blood clot, then oral estradiol may be perfectly safe for you to try. But typically, prescribers will start with transdermal methods just because they know that those are slightly safer and there's no increased risk of blood clot. And most women do very well on the transdermal methods, but some women do not absorb well through their skin at all. And so if you're not a good absorber and you don't have an increased risk of blood clot, if your baseline risk is low, then oral estradiol may be perfectly fine for you. This is just something you need to talk through with your prescriber. Hopefully you are going to someone who is very well versed in menopause hormone therapy and can help you weigh the pros and cons and decide which delivery method makes most sense for you.